All right, welcome back, everybody. We're going to do a question and answer now with the panelists, and I'll let them introduce themselves. So we're going to start with Bessel.
Well, hi. Thank you for watching this movie. And I'm very pleased that the Trauma Research Foundation could sponsor this particular showing. I think it's a terribly important movie, which has very large large reverberations. I was very much part of the beginning of this pharmacological revolution in the 70s. I was a young psychiatrist, and suddenly we had a chance to change people's lives with medications. And some people's lives were changed by medications. So medication had an important contribution to make. But then a whole other issue came in, and that's the low ranking of psychiatry in medicine. Psychiatry is a poor profession. It always is in the basement of the hospitals. And once we started doing drugs, we became a more prosperous profession. We made more money. And psychiatry departments started to make a lot of money on the benefits of the pharmaceutical companies. And so their prestige rose as their income rose. What happened at this point is that psychiatry became a one-man show. Instead of seeing medications as one possible option to help people with, they only learned about medications and they learned about nothing else. I think our culture is like that. It looks for one solution and then we give up other issues. And I think our whole society has moved more and more in people looking for simple answers to complex solutions, and for people sort of giving quick pills and quick fixes to complex stuff. And we are frantic. America is a frantic country. Why do we have symptoms, by and large, as warning signs? We feel anxious because something tells us this is not right. You feel angry because you're not being heard. You feel depressed because nothing is happening. These are signs that something isn't working. Psychiatry jumping in with medicines, in many cases, made this worse. In some cases, it did work. It's not like all or nothing, but psychiatry became a one-man show, and people didn't learn about psychotherapy, and they stopped learning about EMDR, and they stopped learning about other ways of regulating yourself. My proposal is that in every classroom in America, from K to 12, there are 4 R's: reading, writing, arithmetic, and self-regulation, so that all of us live in a culture where we learn what innate capacities we have to take care of ourselves, so that we become informed consumers about our own lives. And for example, I did an NIH-funded study on yoga for PTSD. It turned out that yoga is a better treatment for PTSD than any medication that people have studied. I published 3 scientific articles on that. I've never seen a psychopharm clinic turn into a yoga studio. We have very good treatment for PTSD, like EMDR, but I know barely any psychiatrist who knows how to do EMDR. I barely know any psychiatrist who knows any of the effective treatments for PTSD. I did the very first Prozac study on Prozac for PTSD, and showed that people at the trauma center, civilians, did quite well. At the VA, the veterans didn't budge. In study over study, we showed that veterans do not benefit from drugs. The biggest consumer of drugs is the Veterans Administration. The scientific evidence shows that these drugs don't work. And yet billions and billions of dollars are misspent on veterans who become more and more depressed and more dysfunctional. What is wrong with our system, with our profession, that we don't look at the reality of it? People love to blame the drug companies. I don't. The job of the drug companies is the same way as your drug dealer down the street, to make as much money selling drugs to the unsuspecting public. The person who should be responsible for this are psychiatrists. A psychiatry should learn more than just drugs as an answer to people's solutions. And psychiatry at this point is in a very serious state because they have their money and their income very much tied up with the drug companies, and they don't know anything besides taking drugs. So if you go to a psychiatrist, you can expect the same thing as you get from your drug dealer, you get drugs. And it's important for the public to know that these people don't know anything. So if you want to learn more, you need to look at other things that can possibly help you. That's it.
Thank you, Bessel. How about Angela? You go next.
Hi, everybody. My name's Angie. You saw a lot of my story in the film. I'm now 5 years off of all medications. I suffer from some pretty severe neurological after effects that have not gone away from that experience, and now I have trauma from the medical system. And so it's been a really hard journey coming off, but I did go back to school and I earned my master's in social work, and I did an outpatient mental health, and I actually went to Bessel van der Kolk's conference 2 years ago, and I trained in somatic experiencing. And those are the things that resonate with me that I wish that I would have had 15 years ago to save me from all of this trouble. So now, instead of getting licensed, I chose not to get licensed for many reasons, some of which would be complicit with the system that hurt me, you know. And so now I do conversations like this one. I try to do CEs for behavioral health agencies. We just presented at an addiction conference. So my activism is part of my healing also. So I just look forward to everyone's questions, and thank you so much for having me.
All right, David, why don't you go next?
Thank you. Thank you very much. My name is David Cohen, and I'm right now in Los Angeles. I'm a professor at UCLA. I'm a clinical social worker by training. I studied drug treatments for many years, the history of drug treatments, the effects of drugs, the construction of the effects of drugs, how drugs hurt mostly, the other side of the coin. And I was heartened in a way to hear Dr. van der Kolk start his speech with such a rousing accompaniment to the film Medicating Normal, where I think you've seen me for a couple of minutes welcoming Angie Peacock into my classroom. It was a momentous moment, actually, because many of the students, this was a psychopharmacology and social work class. The students, many of them remember that moment as a turning point because they had a long conversation with Angela at the time. And I remember many of them asking, after Angela told her story, many said, well, what would have helped you at the time? How did you get into this pathway, and what would have changed it? What could have people have done, all these professionals? And I think, if I recall, Angela said, I wish they had listened. And so, and that was something we hear all the time. It sounds really simple, but it sounded also so true, and it meant so much to the people who were in the room. And many of them recall this moment, and it seemed to have changed their trajectory later on. I'm not sure what they're all doing now. So I'm pleased to be here, and I'd love to answer any questions. Thank you.
Thank you, Dave. Bob, why don't you go next?
Well, thanks. First of all, it's a pleasure to be here. Real quickly, I think this movie, Medicating Normal, is really helping to stir a discussion that we need to have in society, a discussion among psychiatrists, providers, people who've been treated, that sort of thing. So rather than provide a definitive answer, it's helping to stir the discussion that like we're having tonight. I just want to pick up on one thing that Dr. van der Kolk said. He says, I don't blame the pharmaceutical companies. I agree. The pharmaceutical companies, in essence, are companies within our society that are supposed to try to generate profits, and they do that whenever way they can, and they often bend the rules and that sort of thing. But our society trusts psychiatrists, the people who have the white coat prestige in our society that are academic psychiatrists. They're the ones that we are supposed to believe in. They're supposed to be the ones that give us the knowledge, the true story. We're supposed to believe in them, not the drug companies. And it's psychiatry, really, and as Dr. van der Kolk said, came under the influence of money, pharmaceutical money, that I think where we're at in 2020 is that We organized ourselves around a false story. Angie got tied into that false story, right? That's what happened to her life. David is talking about how younger people trying to become professionals come into his class with a certain story. And then the question is, are they going to leave his class with that story? Anyway, I think the beauty of this movie is it's helping us to have a discussion that I think we need to have, because here it is 2020. And I think the one thing that most people will agree on is this form of care that focused on drugs as the primary solution hasn't worked for us. And I do agree with Dr. Van der Kolk. There's some people that are helped by the drugs, but that's not the story we were told. And that's not the practices that really we've had. We haven't organized ourselves around that story as a society. So anyway, it's a pleasure to be here as part of this discussion.
All right, thank you, Bob. I'm going to start with the first question. Give me a second here. As a practicing psychiatrist and author of a book on the challenges in distinguishing between normality and psychiatric symptoms, I wholeheartedly share the concern about over-medication. At the same time, I fundamentally disagree with the premise of this film that medication treatment should never be considered if the cause of mental stress is great. If I broke my leg from getting hit by a bus, a competent doctor would not deny me pain medications just because my leg is supposed to be broken from colliding with a bus. Why is there a double standard in mental health? And that's whoever wants to answer can jump in.
I'd love to take that on. May I take that on?
Yeah.
So
yeah.
I'm not sure if I understood correctly the question, but I don't know who is denying drugs from anyone or saying that drugs should be denied from anyone. Did I understand that correctly? Is the question?
No, you didn't. So can you hear me?
Yes, go for it, Dave.
So my question is, there seems to be this premise in the film that if the cause of mental suffering is strong enough, like somebody who's been in combat or has been lost a loved one, that we should not even think about medication treatment because you're supposed to have that suffering under such mental distress. But that's not the way that's not the way anything else in medicine works. And if, for instance, if I got my leg broken because I got hit by a bus, a doctor wouldn't tell me, no, we're not going to give you medications because your leg's supposed to be broken if you got hit by a bus. They would treat the symptoms. So why are we saying something different when it comes to mental health?
So then if I may try to respond to that, I feel that most people who go to a doctor for the suffering, the anxiety, the depression, the worry, the fear, the losses, the lack of sleep, whatever, are not offered enough of a spectrum of options. They are also often told that the reason that they are feeling this way is because their brain is not working right, that there is some sort of imbalance, whether it's electrical or chemical or whatever the latest linguistic. We kind of go from chemistry to electricity now, and yet it's just asserted. So it's not so much that you're reacting to something in your life. It's for some reasons that we don't know. It's already in you. It's an imbalance of some sort, and then you're kind of taken into that. And whether you know or there's proof of that, it's the authority of the doctor who might just say then, well, let's just try that because that might help. You might think a little bit more clearly. You might get a little more sleep. And I think that that's what the movie illustrates, that people come in trusting that they will kind of get an answer. They get this one answer or version, and then they can't get out of it. So that, I mean, to me, the movie sort of just more illustrates, not so much that we should be denying or pushing drugs aside, but it just kind of illustrates that treatments often hurt. And that's a constant theme in the history of medicine or psychiatry. I mean, it's not an abnormal theme. Treatment hurt. That's why we say first, do no harm. And because it's easy to hurt. So the idea is that's what people get stuck in. But the story, I think, as Bob was intimating, Bob Whitaker, is that we get told that this is the solution. And the reason is you are deficient in some way or broken, and this is the way to fix you. So I'm not sure how the symptoms or the causes or the signs get into it, but I've made an attempt to answer you. I hope
No,
someone.
I appreciate that. And I would just clarify that I think that that does happen, and it's an embarrassment to me, but it's not the way I practice, and it's not the way any psychiatrist I know practice. So I think that the film does not give an accurate portrayal of how many people now approach mental suffering.
Thank you, Dave. Okay, I'm going to jump to the next question here. And this is for anybody as well, and whoever wants to jump in here, what are your feelings regarding drug rehabs being unregulated and they're prescribing psych meds to someone in recovery who has, on average, like a 96% relapse rate for people in there? No? Okay.
I have an opinion about everything. So to me, it's like something is being dangled and I'm being poked to answer. I don't know what that means. Drug rehabs being unregulated, prescribing drugs. In other words, is there a licensed physician that has the authority to prescribe that is giving the drugs, or they're just handed out by the attendant or the clerk in the front door? Or I mean, what I don't understand.
I don't. That's all the question said. If the person's here, they could clarify for you, but I don't know.
I think you might be pointing to like when people have addiction histories, they go to rehab, and then while you're in rehab, they say, okay, now you have a comorbid condition. Let's get to the bottom of why you're using drugs in the first place. And then now you have depression and you're bipolar, and we need to put you on all these meds. And so there's this polypharmacy nightmare that happens from that. Is there regulation? No, these people are going to social workers, therapists, psychiatrists. That's the narrative, right? The same way Dr. Dave, who just was talking, is saying like the film is very one-sided. Well, I would say the industry is very one-sided. There's only one route. If you have suffering, you go to a doctor, you get medicine, and you comply with your treatment, and that's it. And so the same is with the addiction industry. You go get clean off of your street drugs, and now you're going to get antidepressants, whatever, another diagnosis. I mean, that's been my experience. And we just did a screening with a bunch of addiction specialists like a week ago. And that's what their industry is doing too.
Okay, Thomas Rodriguez, you can unmute yourself and ask your question.
Hi, good evening, everyone. My name is Thomas Rodriguez. I'm an active law enforcement here in New York, 26 years as a police officer. I want to say thank you for sharing the movie today. It was excellent. I learned so much, and thanks to Angie who invited me, and I'm eager to learn some more. I just wish a lot of my officers in the field would watch this, because I learned so much as a police mental health instructor officer. It opened up my eyes, and I just want to thank everyone for letting me be part of this, and I just learned so much. I don't have a question, just so happy and proud that I learned something today. I was touched by the movie, and seeing my friend Angie, I learned a lot more. So I want to thank you all.
Thank you, Thomas. That's nice to hear. I'm going to call on Marie Ferry now. I hope I didn't pronounce that wrong.
Hi there. Can you hear me?
Yes. We can't see you.
So my name is Marie Ferry. I'm from the Boston area, and I'm also a licensed mental health counselor, and been fortunate enough for about the last 15, 16 years, minus this year, have gone to the conference, the trauma conference in Boston. And I saw Dr. Whitaker speak several years ago and took his book as a Bible after I started getting into it more and more. So my question is, I am struggling with clients who come to me that are so over-medicated, and how can I approach this subject? I finally got so fed up with a cocktail prescribed for one client that I talked to her psychiatrist, begged the psychiatrist to talk to her this summer. And when I gave her my opinion, she went totally silent and wouldn't take my calls after that. And I'm afraid for my license to go out there on a limb and tell my clients, you need to get off the meds. I work with horses. Double question. I'm starting a veterans program in South Florida. Dr. Kolk said the veterans have the highest How do I approach this?
I would love to answer that as a non-physician who has been working for almost 30 years with individuals, helping them withdraw from psychiatric drugs. There is absolutely nothing you should fear if you speak with your client. So speaking about medications is perfectly legal. The barber can speak with the client about the medications. So the question is how you inform your client of what you and your client are about to do. And you can, in other words, your client deserves to provide informed consent about the work they will do with you. So you want to carefully describe what you would like to work with this client about. It could be about discussing how they feel about medications or exploring other options besides medications. That's the first thing. And another thing is you want to not present yourself as knowing things that you don't know, as having an expertise that you do not have. So I think these two are fundamental things, fundamental principles about working with people, so that they know what you and that person are getting into, and that and the other things is that you cannot, as a non-physician, dispense or prescribe or administer medication, and that's, unless you want to be completely in illegality, then you don't do that, and most social workers or psychologists don't do that. But everything about speech is completely protected regarding medication, as far as I know.
See, I think as a non-physician, your job is to provide people with alternatives to medications. And so all of us in the mental health field need to be deeply familiar with a number of options. We need to know how we can regulate our arousal by the way we breathe. That's sort of a very elementary thing. We need to learn how we can regulate ourselves by the way we move. There's a voluminous literature that shows that hard exercise always beats psychiatric medications for depression. Not a single hospital that I know of has a hard exercise program because there's no money in a hard exercise program. But hard exercise is really effective for depression. I always go back to basic training in the military, which is an outstanding program to get a bunch of maybe not so well put together, very frightened kids to work together. What did they do? They do hard exercise, they sing together, they move together, they're in rhythm with each other. And so actually basic training in and of itself has some very core elements that can help people tremendously to regulate themselves. And I think every mental health professional owes it to themselves as should not charge people money until they have a whole variety of different capacities to help people to calm themselves down that are not necessarily a function of drugs. And so that's the job that we all have, is to become as familiar with as many different ways in which we can help people to regulate our own bodies as we can. But as long as you don't learn it in school, you cannot tell people about it. So you have no alternative to medication. So it's very important, and that's why I wrote in my book all these different options that you might have, is to really learn a whole variety of different methods. So you can say to your patient, why don't you do that? For example, last night we had a movie about neurofeedback, which I hope some of you heard. Neurofeedback is this very effective treatment for a whole bunch of conditions. You play computer games with your own brainwaves, and you train your brain to become focused. When we do neurofeedback with people, there are medications, and after a while they stop taking their medications because they don't need them anymore. So if you want to become a clinician who doesn't like medication or can't prescribe medication, then learn some very good methods that help people to get themselves to be calm, and say to your patient, well, I don't want to argue with your psychopharmacologist, but why don't you try a tango dancing class to see how your body can move with other bodies? Or have you tried boxing or martial arts? Boxing and martial arts are very good programs to give you a sense of power in your body and agency in your soul. But that is what we're supposed to be experts in, is to really help people to find ways out of their depression, out of their anxiety in non-pharmacological means. But that means we need to know it.
And I just want to add to that, believe it or not, like I would never believe this had it not happened to me, but there's like, I could probably show you right now 100,000 patients online that are tapering their own medication in absence of medical help. Okay, so there's this vast majority of people, because there's no just deprescribing movement. There's a tiny little thing at Yale and a little bit of thing here in Canada or whatever. So now these patients, like you saw in the film, are figuring it out on their own. I had to figure this out on my own. I had to become my own psychopharmacologist. You know what I mean? So I would say I did put a link in the chat. It's guidance for therapists from the UK about talking about psych drugs. Just simple questions like, what does it mean for you to have a diagnosis of PTSD? What does it mean for you to take psych drugs? Like, these questions are not being asked at all. Like, we're taught as social workers to not ever talk about medicine with your clients at all. And I think that does a huge disservice, that like we're supposed to look at their life holistically. Oh, except for medication. Like, come on, that's part of their life, you know? So we need to get back in that conversation somehow. Not so worried about our liability. I understand that's a concern, but that kept me from my life for 15 years, that nobody said that. Like, it's not a little thing. These people are suffering, and it's like you believe that it's you. Like, I've become this drugged mess that drools on myself and doesn't leave my house. I'm just mentally ill. Like, the life is like taken from you. Do you know what I'm saying? So it's not a little thing. We need to get back in that conversation. But I would just say, saying gentle things about, there's a website called Inner Compass Initiative, or the Withdrawal Project, or survivingantidepressants.org, or Benzo Buddy. So there's these peer forums where people can get information about drugs, just in whatever way that they see it. But that's what I would say. Sorry.
But do give people alternatives.
And alternatives.
Say, withdraw. Say, have you tried the therapy dog?
Yes.
Therapy dogs are very helpful to help people to calm themselves down. Have you tried equine therapy? Yeah. Have you joined a chorus? A choral sing is a wonderful way of helping you to feel at one with other human beings and calm your body down. Have you tried a regular yoga class? Have you tried, you need to really help people to find alternative ways of calming themselves down, because the reason why people go to psychiatry in the first place is because they are messed up. But they go to this one-man band who say drugs are the answer. And so what we need to do is to say, okay, drugs may be useful, but maybe mountain climbing might be helpful, or singing might be helpful, or martial arts might be helpful, or any number of other possibilities.
Yeah, and in my own journey, I did equine therapy. I got a service dog for PTSD. I did a lot of like CrossFit style HIIT workouts. I did creative writing for a time. So all those things are what led me to here and helped me get off the meds for sure. Right. But that process was like a 10-year process from, okay, let me, and they're still evolving and they're changing. I do neurofeedback now and heart math. I do boxing with Tommy. We do boxing on Wednesday nights with a bunch of vets, So yeah, it changes.
And you meet some awfully good people in the process of doing that.
You do.
So you gather people around you on your journey to recovery.
And I met people that weren't asking what was wrong with me. It was, hi, ready to go see the horse? Get on the horse. It wasn't, tell me your symptoms. What is, the self-monitoring stuff that we have to do for going to a psychiatrist. Like, what am I going to say? No, it was like, get on the horse, pick up the poop, let's go,
This is so sensible. This is so sensible. I mean, what Dr. van der Kolk just said, Angie said, and what Dr. van der Kolk said at the beginning of this, your first introduction, this notion that we're so frantic and we're also we try to get so specialized. Mm-hmm. We're so specialized and we think there's one answer and a simple answer. You mentioned the word America in the sense of, as this could be something that we do really well here. We get very excited in America, stereotypically, speaking, about these one-shot answers. We try to reduce the active principle of whatever it is and then market it in a big way. And everybody thinks, oh, this is it. This is the answer. And everything else is downplayed. But, when we talk of alternatives, as you did, everything is an alternative to drugs. everything can be an alternative. So it's wonderful to hear that tango and boxing and writing and loneliness and togetherness and all these movements, are so useful, but they've been downplayed. It's like, oh, anybody can do that, so it's not professional. I need to see the professional.
Anybody can do that means nobody can make money off that.
All right, I have a question here. Let me just find it real quick. I'm wondering what to expect if someone is struggling but doesn't know if the medication is helping and wants to come off it, but is worried that coming off it might make the problem worse, the initial problem worse. Do you have any suggestions?
Yeah,
And that's open to whoever.
let me go back to what I said before, is try something else. My book, The Body Keeps Score, is not the only book that will give you a variety of different options, but try to look for a variety of different options. Don't go off your medications necessarily. Find something that makes you feel good. And once you feel better, start tapering off your medications.
Well,
I think that's, yeah, go ahead, Angela.
Oh, I was just going to say, that's another thing that we often encounter talking to prescribers is like, there's still this thing being conflated. Probably David Cohen can talk about it better than I can, but the difference between withdrawal and relapse. So when you come off, at least my experience was not a good one. I didn't even speak for 4 months. Like I didn't shower standing up for 2 years. I literally laid under a blanket counting my heartbeats, trying not to kill myself for like a year. Like it was not a good experience at all. And the problem is that like nobody warned you about this, so like you find yourself here and you're like, oh my God, what is happening to me? But I knew that I was tapering off the drug when I got to a certain point and the doctor stopped it. That's when this happened. So it was like a switch flipped. So I had a clear causal, this is the event that happened. Now I'm in withdrawal. I figured it out. Thank God I figured it out. But I also knew all these emotions and these withdrawal symptoms that I'm experiencing are not some new illness that just popped up. But I had to like read about that to figure that out, right? So I'm like, oh my God, now I told my friend, I'm a mental patient. You need to take me back to the hospital right now. And she's like, Angie, no, if you go back to the hospital, they're going to put you on more meds. And she saved my life. Okay. She saved my life because the symptoms that I was experiencing, let's just say I would have met criteria for something way more severe than PTSD. So anyway, so there's that difference between what is withdrawal and what is relapse. And is the person resilient enough? I mean, who would ever know how to measure that? But the amount of suffering that I had to deal with to get to the other side, do you know what I'm saying, is like enormous, inhumane suffering that I cannot even explain. And not everybody experiences that, okay? Some people can cold turkey off a drug and walk away after 30 years and be completely fine. But there's a spectrum of withdrawal experience. We don't know where you're going to end up. I thought I was fine. 6 years ago, I was running Tough Mudder. I was doing CrossFit 5 times a week. And then the next month I couldn't get out of bed like that. So, I mean, how do we know who's going to be affected by withdrawal and who's not, who's going to relapse, who's not? Are we informed of all those things that could happen? It could be a mild, you might be sick in bed for a week and then you're back to work. Nobody knows that. So I would say everybody needs to do, there's no one answer. You have to do all your research. You have to talk to many people. You have to listen to discussions like this one, read a book like David's, read a book like Dr. Van der Kolk, read all these books and then figure out for yourself, if you're even able to read, because the amount of drugs I was on, I couldn't even read about this. I didn't find it until after I was off, but it's just a hard decision. But I even all the suffering that I have endured, I still say a bad day off of drugs is still better than a good day on them, because I have my freedom and my cognitive, you know what I'm saying? Like I'm not perfect, but there's something that happens to you when you're a patient and you take pills every single day and you go see your psychiatrist and you report your symptoms and you go see a therapist and you talk about how shitty your life is. And when you do that for 15 years, neuroplasticity is real, correct?
Yep.
Then we are wiring that shit. Excuse my language. Sorry, can't help it sometimes. So you're wiring it, So now I have had to unwire, and like there's good things about me, and I'm smart, and I'm getting anyway. So it's a very heavy decision, and some people may choose not to come off, and they should be allowed to have that choice also.
There's also the idea, simple old idea that the effect of the drug, or also stopping to take the drug, is a function of the drug, the setting, meaning it's a function of It's going to vary according to your biochemistry, according to your psychology, your learned habits, everything, your view of yourself, and also the socio-cultural context, large and small. So that's a lot of variation in there that may explain why you can't quite predict in an individual case what's going to happen as you take or stop taking a drug. And that's what, there's just so much variation, so much. We're all so different, and the contexts and our expectations are also different. So in answer to that original question, the person is worried that if they slow or reduce, that, it might get worse. It might not, but there's different ways to reduce. You could just, reduce a little bit and just see what happens. In the US, drug doses are usually quite high compared to other countries, and so many other countries. So there's just a lot of room to move. And finally, as Angela was saying a couple of interventions ago, the best thing is to go and see what people say who have been in the same situation, what they say about that precise situation they were in and how they dealt with it. Mm-hmm. There's so many examples. So it's that whole peer support, someone who's been there, they felt that, what did they do? And then learn from that and decide on your own way.
I listening to the questions and the answers, just going back, I think one of the problems is the whole conception that our society has sort of embraced. It is so problematic. The whole way we think about this is so problematic. So you go to the first story, the first question about, well, it's like a broken leg. Well, with a broken leg, you know something and you want to get it fixed. When someone comes in with a psychiatric difficulty, whether it be depression, anxiety, psychosis, you don't know what's going on. You just don't know the biology of this. And actually treating with a drug is like some people might do better and some people might not. It's not the same thing of fixing a broken leg where you have a pretty good idea that it's going to be helpful for that person. And then because there's such a wide spectrum of outcomes on these medications, you don't know what you're doing. You do know with these drugs, you're sort of perturbing some normal functioning in the brain. And then someone talked about if they get on cocktails. Well, if someone's on a cocktail, you're pretty sure that this isn't working for that person, that they've gone down a path. Otherwise, why are they on a cocktail? Because it isn't really working. And I just think we need to have a conception that says, we don't know what's going wrong biologically. These drugs can do harm. Doesn't mean that they never do benefit, but we have to recognize they can worsen things. And then we also have to recognize, like Angie was saying, that coming off, yes, it can be very difficult. Yes, there's all sorts of perils. Those perils are often related to being on the drugs in the first place, but coming off can be a path to a better life. That is quite clear, to recovery, to getting back your life. Angie speaks to this. I can't tell you how many people with lived experience talk about getting their lives back. So we need a conception that begins with humility. We don't know what's wrong. We do know, by the way, as Dr. Van der Kolk and others have said, people respond to their environments. There's all sorts of ways that environmental changes can be a path to healing. And then we just need to understand drugs can do harm, and that coming off the drugs can be a path to recovery, to health, to a better life. And I just think somehow we need to have a different discussion that puts the whole framework different as we think about what we've been doing.
Well, for one thing, we need to get rid of the DSM. I can say that because I was one of the people who helped create the original DSM. I was on that task force. And why did we create the DSM? Because we were cheerful that drugs would find solutions. And so we created categories in psychiatry in the hope that this category would lead to a drug cure. And we were very optimistic. And it turned out, oh, it didn't work. And the categories are false categories. But now we're still stuck in the categories we created back in 1980, when we thought that drugs had more promise than they actually had. And again, drugs aren't always bad, But people take 6 times, as Robert so beautifully says in his book, people take 6 times as much drugs today as 20 years ago, and there's more depression. And people take more antipsychotic drugs, and there's more psychosis. And so all these drugs, by now, we should be the healthiest people in the world. Because we're taking all these drugs. We should be perfect by now. In fact, we're sicker than we were 30 years ago. We're not doing something right, And let's start off with not giving people bullshit diagnoses.
Can I ask a follow-up here? And whoever wants to answer it, what can you measure? Like, is there any way to measure brain chemistry and prescribe something that works, or is the science not far enough along there?
What we can measure? People's lives, people's capacity to focus, to concentrate, to feel pleasure, to feel engagement with other people, to start a project and to finish it. There's a whole bunch of things that really characterize who we are, none of which are captured in the DSM categories.
Or in any clinical trial.
Right, that's right.
Okay, I'm going to call on Michelle Waterman now. Michelle, if you want to, and then I'll call on Kristen after that.
So thank you. I just wanted to thank the panelists, and I'm so grateful for this film. I was on meds for 16 years. I'm 16 months off. And what I really value about this film is the importance of informed consent before anybody goes on meds, and also the informed consent needed to get off meds. So I'm really glad that Angie talked about the resources that are available for tapering. What I also found problematic for me when I went on meds in 2002 is that I was told that I had a brain chemistry imbalance, which has not been proven by science. And so it's, when we talk about going to a psychiatrist, it's supposed to be helping us. I would never know not to believe that person when they say, oh, you have generalized anxiety disorder, you have a brain chemistry imbalance, that explains why you drank alcoholically, since I was a year sober when I got put on meds. I would not know to question that. And so it's wonderful to hear a psychiatrist say that we need to get rid of the DSM, because I don't think I had generalized anxiety disorder. I think that I was 3 months postpartum, and that I had a son with autism and a husband with a head injury, and anybody going through what I was going through would feel overwhelmed. And there was nothing wrong with me, like Angie talks about in the film, that she came back from war and she was grieving. And so I'm so glad I'm not on camera because I haven't showered today. I'm not doing great, but I'm here and I'm grateful to have the poison out of my system, and I know I will recover. I'm so grateful that there's psychiatrists out here that are saying, hey, let's get rid of the DSM and let's start looking at people as individuals and look at them collectively, what's going on in their environments, and get community around these people. Nobody's saying meds should not be an option, but I think that we have to come a lot farther to help people understand that there are risks. And a year on meds, when I'm told, well, what should I do now? I'm feeling better. And I'm told the dose that got you well will keep you well. That is a crime, because that didn't continue to be my story. And the doses kept upping and the meds kept adding, and the more diagnoses I got. And so I'm grateful for this film, so very grateful for Angie and Robert's book, and also for The Body Keeps the Score. That's been very helpful. So thank you so much for this film.
The biochemical imbalance idea, I mean, this is a very, very important kind of issue to tackle. Many people have done it, but it's just it's an archetype. It's not quite seen as that. It's often seen as some kind of theory or more or less validated. It's not. It's really an archetype. It's kind of just an ancient idea that is very resilient. It's very useful, very helpful. It gives meaning to people of why they hurt, or also why they recover. It's very tied to drugs. It's, I was feeling bad. I took the drug. I feel different. Something was wrong, and this notion will never go away, by the way. It's just recycled by those who recycle it, but who peddle it. And psychiatry has made a fortune by recycling this notion of chemical imbalance. It's really, It's a basic ancient, I mean, it's so ancient. It's thousands and thousands of years old. Disorder as imbalance is a basic idea. It's not necessarily true in all the time, but we resonate with it so much. So what are the other alternative narratives we have to explain? Why we get hurt, how to feel better, how to explain how we feel after we do different things like tango or box or take drugs. We need these stories to be more in the culture. And it's hard, I guess, hard to get them in and be thought of as valuable. Or maybe it's very easy with social media now. It's hard to tell, but that notion of chemical imbalance really has to be tackled and looked at, just not as some kind of scientific theory, because it's unfalsifiable. You can't falsify it. You can't even test it. And we can't replicate any of the assertions and predictions. And but it's strong as ever. And so let's just put it in its place as archetype, like the hero, the wanderer, the whatever, the imbalanced. But it's just an idea like this, and then move on and come to it when we need to. But when we don't, stay away from it. This is not science, and psychiatry has never needed science to push its treatments, ever. Never, ever needed science. It never needed evidence. And when it has it, it doesn't look at it. So just my 2 cents here.
Thank you. Kristen, you can unmute and ask your question now, Kristen Caldwell.
So in what we're talking about and all the films that I'm putting things together. And so I'm just kind of, Dr. Vanderkoor, I guess this might be your question, or anyone who's kind of in the neuroscience field. So would it be prudent to suggest that a client get an EEG before any type of treatment starts? Will that give some type of diagnostic, something that will point us in the right direction, or not?
Can I say something really quick?
Yeah, sure.
Just that there's a question before that. The question that I learned, at least in doing my outpatient mental health internship, was that people have real reasons why they feel the way they do. Like real housing, racism, oppression, the pandemic. There's reasons for everything. We don't need an EEG to figure out the reason. We just ask and listen. It's pretty simple.
I'm not speaking to, of course, there's always, when you sit down and you do an intake, I can only speak for myself. I ask all those questions, right? I'm speaking to those things where it isn't so glaring, or you may not know what might be going on. Aside from just everyday stressors, there could be one of the things that with diagnosis that you're supposed to always rule out the physiological first. And is there something physiological going on that contributes to the symptoms that we're seeing that's being presented to you? And so those are the kind of questions that have me thinking, like, how do you tell a client to really advocate for themselves? What do they need to say? What do they need to ask for in order to move forward towards figuring out what's going on with me?
I think you're completely asking the right questions.
Yes.
And I think a clinical evaluation is where you start. What is going on with you? How long has this been happening to you? When do you not feel this way? When do you feel this way? What is the age of onset? What were the circumstances where this happens? And are you able to reset yourself by doing certain things right now and other things not? So you really get a picture of somebody's life in a historical and contextual way. If you find that somebody is never able to concentrate, cannot focus, cannot finish something, I may want to do an EEG to see if there's some abnormal wiring going on. If people say, I feel okay, but the moment I close my eyes, I become terrified, an EEG might be helpful to show that the moment you close your eyes, the back of your brain goes crazy because there's something in your survival brain that thinks, I'm going to get killed if I close my eyes and I don't pay attention. So then we need to bring that attentional system down. What's the best way of doing that is something we don't know at this point. And so it becomes an empirical question. So I wonder if you suffer from hyper arousal and hyper alertness, whether becoming a very good martial artist might actually help your brain to learn to focus that. I don't know. I know that neurofeedback can do that. If there's a trauma, will processing the trauma and really going in detail about it and helping to really lay it to rest, will that calm the whole system down? We don't know for sure, but it certainly is worth trying. So basically, somebody talked about humility and all this sort of stuff, is every person is an issue of trial and error. And we all are trial and errors. We are all creatures in the making. And things that work for you may not work for me. And so it's always like, hey, we have 5 different options. Let's see what the best is for you. And you always check back with, how's that going? Are you feeling more in control? Are you feeling more energetic? Are you able to sleep better? Are you feel more relaxed? And it's always a journey. It's a journey of discovery, always, for all of us, all of our lives is.
I understood the question at first. It made me think of something else, which is that because the movie is about drugs and the effect of drugs, it's probably a great idea to obtain a baseline before you start drug treatment, because we know that your liver function and your heart function and lots of other things, every organ in your body is going to be affected. And especially when we look at the literature, we often say, well, we can't find very clearly and identify how drugs cause harm to the body. And one of the main reasons is we don't have that before picture, whether it's an EEG or MRI or EKG or evoked potentials or just blood pressure and heart function and things like this that we should start taking before people are started on medication, so we have something to compare with after. And that's something that's like missing, not only in individual cases, although there are guidelines. Let's say if you're going to start a child on antipsychotics, guidelines that are not adhered to, you're supposed to take a whole battery of different kinds of tests and things, because we expect that these functions are going to go wrong. So you want to do that at first. That's how I understood your question. That's where it led me. Yes, it's very important to take physical measures, basic ones, and keep taking them as a person is under drug treatment. It's key.
Okay, thank you. I'm going to call on Adriana Stacy now. Adriana, you can unmute yourself and ask your question.
I think it's really unreal.
We can't hear you very well.
Oh, okay. I'll try and speak louder. I got it on a different. Can you hear me now?
Not much better. Just try and keep the
Okay,
question short then.
Okay. Take off my speaker. Okay. Okay. Off. Can you hear me now?
Sure, go for it.
Okay. So I have a little different side of the coin here. I was a person who, after 17 years of drugs, I only was hypothyroid at the beginning, overworked single moment, my second degree, and got kind of drugged in that way. There was never counseling at all. And, it's not, I'm not against psychiatry at all if it's done properly,
Excuse me, but
We can't hear you very well.
I've heard
Yeah,
that.
Can you type your question out and we'll get to it a little bit later?
Okay.
Sorry
I'm
about
turning my off. I just use the speaker because I've got hearing difficulty. I'm just trying to turn off. And good morning. Turn off.
Here, just type it out. We'll get it. Okay, let me get to one in the meantime. Give me 1 second here. Okay, here we go. And this is for whoever wants to answer this. My daughter has been on benzos for 6 years, 6 milligrams of lorazepam. She recently stopped taking codeine and another benzo, which she has been taking at night. So now on 6 milligrams of lorazepam a day. We worked out a year-long tapering regime. Is that time frame realistic for someone who has been on it for 6 years?
How long is a tapering regime?
About a
6 weeks?
year. About a year.
I mean, nobody knows. Nobody can give you a clear answer, to be honest with you. 6 milligrams of Ativan was 6 times the amount I was taking. So I was only on 1 milligram, and it took me, well, I started at 3 milligrams. So it took me a year and a half to taper that down. And then when I got to the very end of the taper, I became extremely suicidal, and I was admitted to the hospital. And that's when the doctor abruptly stopped it. And I was following a slow, sensible taper under the guidance of a doctor. So, I mean, there's no answer to this. That's the problem. Nobody knows if you should go slow or fast, or you're going to have withdrawal, or you're not going to have withdrawal. It's nobody knows.
Okay. All right. I think we're coming to the end of the panel here. So I'm going to ask all the panelists to do a last word. And like I said, I'll leave this open for a few minutes after. So if people want to ask questions and the panelists want to hang around for a little bit, they're welcome to. So what I'd like to hear from each of the panelists is, what do you think the viewers' takeaway should be from the film? And try and be concise and keep it, to 1 or 2 sentences. What would be the best takeaway? All right, let's start with David.
I think the film illustrates that treatment can be traumatic, that treatment doesn't just help. It may help some people. It may hurt other people. This is a big issue that has so many different levels. People should situate themselves where they are, and probably no one person can change all of the thinking and have the discussion and have the available treatments available and less harmful things available and all that stuff. But the takeaway is treatments can hurt. Be careful, protect yourself, find like-minded people, and try to move forward.
Thank you, Dave. How about Bob next?
Yeah, I think the takeaway is that we as a society have organized ourselves around a certain story that put drugs at the center of our response to emotional difficulties, psychiatric difficulties, and it really hasn't worked for so many people, or really for us as a society as a whole. It really isn't grounded in good science and an honest relating of that science. And so we as a society need to really rethink this whole paradigm of care. That's what I think the message is.
Okay, thanks, Bob. What about Bessel next?
Well, I think, first of all, I think every medical student and psychiatrist should read Bob Whitaker's book, The Anatomy of an Epidemic. I think that really should be a core text in any medical school to really teach doctors to be skeptical about the given stuff that we all learn. And the other thing in the cultural level, and this is a really tough one, but I think it's very important because we try to do it with our own family and kids, I hope, is that in some ways we need to become our own doctors in a way. We need to really become aware of what makes me feel better, what helps me. Is this working for me? Is this not working for me? And to become really, we owe it to ourselves that we have only one life to live. And in that one life, we need to really get to know ourselves and see what it is that this little creature needs and what benefits this creature. And I think that nobody really should be in a position to tell us this is what you have to do, except when you have terminal cancer, where you have no choice but to just surrender to what the doctors tell you to do. But the rest of the time, we are supposed to become informed consumers, and we should assume that the people who we consult with may not be more knowledgeable than we are, which is a very sad piece of reality when you pay somebody a lot of money and they may not know more than you do. a tough thing to reckon with. Yeah.
Thank you, Bessel. I'm going to let Angie have the last word here then.
Well, thank you. No, I would say pretty much what Dr. Kolk said is what I learned in this process was to not give up my bodily autonomy or to like trust some higher person to know what is best for me. And when I look back on a 24-year-old who was just really scared after she got back from war and didn't really have anybody to talk to about that, it's like a decision that impacted the rest of my life. So I would say that grab your community, whatever that is, like if it's church or your family or your neighborhood. Sorry. And just find somebody that cares about you and just listen and talk to them. Because I don't want you to think that my story is like the only one. There's the hundreds of thousands of people like me.
Yep.
And then we come off the medications and it's such a taboo topic, you know, to say that you're mentally ill and then to say that you take medications for that and then to say that you came off of them and then to say that you were harmed by the system that was supposed to help you. There's nowhere for us to go. Do you know what I'm saying? So we have each other. So I just think as a society, we really need to reevaluate our relationship with psychiatry, with psychology, with mental health, with thinking there's something wrong with us and all of that, and just hold tight onto each other.
Wow.
Thank you.